It's a historic moment in Indian medicine, the first ever three-way liver transplant swap. Imagine three families with three terminally or possibly fatally ill patients, all on a waiting list for a liver transplant, all too ill to actually have too much time. And then family members who are willing to be donors, but their organs are not a match. What should happen then? Three strangers found their lives tied together by a twist of destiny and fate, but also some very compelling medical intervention. A historic procedure, a mammoth Herculean procedure that involved 55 doctors and nurses and 12 straight hours of surgical intervention to make this historic three-way transplant swap possible and giving a new lease of life to three strangers who now find themselves interconnected with people that they had never even met. Let's introduce our very special guest on the program today as we talk about this epochal moment, I think, in our medical history. And you can see on your screen three of the families that were able to get a new lease of life, thanks to, of course, the team at Medanta led by Dr. Soin. Let me introduce the families first. Saurabh Gupta and Chandni are with us. Good to see you. Also joining us is Adesh and Harman. And also the third family is Sanjeev. Dr. Soin, of course, was the team that led this intervention. And finally, Sanjeev Kapoor, as I said, three families who find themselves today alive thanks to what can be called the intimacy of strangers and the power of science and medicine. Let me start with Dr. Arvinder Soin, who led this historic mammoth operation. As I said, Arvinder, 55 doctors and nurses, 12 hours. But if you were to explain very simply to our audience, what happened? These were three terminally ill patients. It was a matter of life and death. They didn't have time. They were on donor lists. Their family members were willing to donate their organs, but it wasn't a match. Tell us what happened. Tell us how these families came to you, and tell us how you came up with this history-making surgical intervention.
Barkha, what happens is that we have lots and lots of patients who have liver failure or liver cancer who are on the waiting list to have a life-saving liver transplant. But unfortunately, all of these people can't have liver transplants because there aren't enough donors. There are two kinds of donors: deceased donors, for which there's a waiting list of approximately 6 to 12 months or even more in India, and living donors who have to be essentially family members who have a matching blood group, who are 18 to 55 years old, are not too overweight, and of course are from the family. So, and we are constantly, striving to increase the liver donor pool so that more people can have access to liver transplants. So, as it happened in the case of these three families, um, they individually, of course, separately came to us over a few weeks, and each had the need for a liver transplant. And each family had a patient and willing donors, in fact, more than one willing donor. But none of the donors were actually suitable to donate, not because they were not healthy or medically fit, but because they, in two cases, were of different blood groups. And in one case, the amount of liver that would have safely come out from a donor would not be enough. It would be inadequate in volume for the recipient. So we've actually been doing what's called swap transplantation, typically exchange of livers between two families of each family having different blood groups. When the exchange happens, the right blood group goes to the right patient. And this is legal. This has been going on for approximately 13, 14 years in India. We started this in 2009. But this was an occasion where three families were there, and we had never done a triple swap before, and I don't think anybody in the world had done it before. So how we planned this was that the donor of pair one would donate to the recipient of pair two. The donor of pair two would donate to the recipient of pair three. And the donor of pair three would donate back to the recipient of pair one. And that is how this chain was planned. of course, it's easy to write on paper, but we were basically supposed to get 3 donors, 3 patients, all ready, set up, and medically fit on that given day or for that given day where the surgery was planned. Then we had to plan it in 6 operating rooms. We had to make sure that all the recipients would have good expected outcomes. And of course, we had to make sure that all 3 donors were safe. So senior anesthesia and surgical teams had to take care of the surgery in all the operating rooms. So that's why it was a huge undertaking, actually, ethically, logistically, and technically. But we went through the emotions. We went over this several times. We did mock drills on the day before. And of course, we informed the family of what we were planning. There was a huge responsibility on all of us because this had never been done before. But we knew we could pull it off because we had done 2-way swaps, and 3-way swaps have been done in kidney transplantation, but then that's a much smaller operation, logistically less formidable. Anyway, so we planned all this, and then we eventually went ahead. 6 operating rooms, 6 separate anesthesia and surgical teams, 6 operations. They all happened simultaneously, and eventually you see the results. So all 3 recipients received the right size liver and the right blood group liver, and they were all able to be saved.
It is, it calls for so much sort of congratulations and kudos. But before I talk to the families, Arvinder, I have to ask you, what was making you the most nervous? What was the biggest challenge during this process?
Barkha, it wasn't one thing that was making me nervous. There were several things. One of them is that all these patients who have liver failure are pretty precariously balanced. And today they are fit and tomorrow they may not be. So one was to make sure that they were all medically fit and ready on the same day, you know. And we typically do something called day -1 tests, which are done like a day before. And we were all holding our breath, just hoping that all the tests would be in order, because even if one was not in place, all the 6 operations and the whole project would be cancelled. So that was one of the first things before the surgery. And of course, before that was, of course, generally getting the logistics in place. The regulatory authorities were consulted. They had never cleared such a case before. But those things weren't making us nervous, but they worked us. They made us work a lot, and we tried to get precedences from outside of the country and within the country in kidney transplantation. Eventually, the regulatory authorities agreed to clear this case, and then we went ahead preparing them medically, and then they were all fit on the same day. And then, of course, was the ethical kind of dilemma that we had to make sure that all of them received the same level of expert care, so that they would be expected to do well, right? So the surgery itself was, of course, something we do every day, but not in 6 operating rooms all at the same time. So those were some of the thoughts as we went into this
And I want to talk to the
swap
families.
operation. Yeah.
Were the spouses in all 3 cases the donors? We see Chandni and Harman here. And who were the donors in all 3 cases?
So in Adesh's case, Harman is the son, and in the other 2 cases, Saurabh's wife and Sanjeev's wife were the donors.
Fantastic. So let me actually start with Saurabh. Saurabh, आपसे शुरू करती हूँ. Today, how are you feeling after this intervention, and to be connected with 2 families? पहले आपकी कोई जान ना पहचान, आज आप ये 3 परिवार, you are linked by, आप साइंस कह लीजिए, डेस्टिनी कह लीजिए, दोनों कह लीजिए, डॉक्टर सोइन के साथ का नाम ले लीजिए. क्या कहना चाहेंगे आज आप, सौरभ?
जी, ये तो डॉक्टर सोइन सर का आशीर्वाद था कि जो इस मुकाम पे ले आए मुझे यहाँ पे. आज आपके सामने हूँ और इन 3 फैमिलियों का शुक्रगुजार हूँ. और मैं क्या कह सकता हूँ इसके सिवा कि आज मैं बिल्कुल पूरी स्वस्थ हूँ, बैक टू लाइफ हूँ. सारे काम अपने दोबारा चालू कर दिए मैंने, और यही है मैम. मेरा एक्सपीरियंस तो जो भी रहा अच्छा रहा, बेस्ट रहा ट्रीटमेंट में.
और चांदनी, आप क्या कहना चाहेंगी? आप एक डोनर रही हैं.
मैं भी
आज
बात
आप
करती हूँ.
बोलिए.
सॉरी आप.
नहीं नहीं, आप बोलिए, आप क्या बोलना चाहेंगे?
मैं बहुत खुश हूँ, मेरे हस्बैंड वापस से सही हो गए हैं। बहुत प्रॉब्लम आ रही थी, सरवाइव करना बड़ा मुश्किल हो रहा था। हम कई जगह गए पर इलाज नहीं हो पा रहा था, फिर हमें ट्रांसप्लांट के लिए जाना पड़ा। बस हमारे पास डोनर भी नहीं था, सर ने डोनर भी अरेंज कर दिया, तो अब हम बहुत खुश हैं।
तो चांदनी, आपसे पूछती हूँ, क्योंकि आप डोनर हैं, पहले तो आपने सोचा होगा कि मैं अपनी हस्बैंड को अपनी ऑर्गन दूंगी, लेकिन डॉक्टर सोइन ने
जी
जैसे समझाया, आपका जो लिवर था वो मैच नहीं था, तो आज आपका लिवर, आपके लिवर से एक अनजान परिवार में लाइफ सेव हुई है, लेकिन
जी।
उनकी सॉर्ट ऑफ ऑर्गन डोनेशन के कारण आपकी हस्बैंड सौरभ की भी लाइफ सेव हुई है। तो इसके बारे में क्या कहना चाहेंगे आप?
ये बहुत अच्छा चयन स्टार्ट किया है, क्योंकि अगर जिसके पास नहीं है डोनर तो वो क्या करे। अब हमारे पास कोई ऑप्शन नहीं था, फिर हम कहाँ जाते। तो ये जो डॉक्टर ने स्टार्ट किया है स्वैप वाला, बहुत अच्छा स्टार्ट किया है। इससे ये है, अगर हमारे पास ऑर्गन नहीं है फिर भी हम अपने इंसान की जान बचा सकते हैं। तो इसलिए
जी।
मुझे काफी अच्छा लगा।
और आपको डर लगा जब आप
नहीं,
डोनेट कर?
मुझे डर नहीं लगा था।
बिल्कुल भी नहीं, जरा सा भी नहीं?
नहीं नहीं, मेरी पहले भी एक दो सर्जरी हो चुकी है, तो मुझे सर्जरी से डर नहीं लगता।
संजीव, आपको लाती हूँ कॉन्वर्सेशन में। आप क्या कहना चाहेंगे? इन योर केस ऑल्सो योर वाइफ वाज अ डोनर, और लेकिन आपके पास वो नहीं आया ट्रांसप्लांट, वो एक और फैमिली के पास। आई एम जस्ट वंडरिंग, आज आप लोग क्या मिल चुके हैं एक दूसरे से, कि आज पहली बारी एक तरह से एक दूसरे से बात कर रहे हैं? ऑल यू थ्री फैमिलीज हु आर जॉइंड बाय डेस्टिनी एंड साइंस। संजीव जी।
मैडम, हम लोग मतलब वहीं पे मिले थे हॉस्पिटल में ही। जब हमको पता चला कि मतलब डोनर अरेंज नहीं हो पा रहा है, तो फिर वहां पर ये स्वाइन सर के द्वारा ये जो प्लान किया गया पूरा सर्जरी की, कैसे कैसे किसको कैसे मतलब लिवर मिल सकता है, क्योंकि वैसे तो मिलना बहुत मुश्किल हो रहा था और इतना वेट करने का टाइम भी नहीं था कि भाई अपन एक एक साल तक मतलब वेटिंग में, जैसा स्वाइन सर ने बोला कि वेटिंग एक साल तक की मतलब हो सकती थी, हो सकता है ज्यादा भी हो सकती थी। लेकिन जिस तरह से प्लान किया गया और ये मतलब केस पहला इंडिया में हुआ है, और इससे मतलब हम लोगों को नहीं डोनर होने के बाद भी एक लाइफ मिली, और एक 3 लोगों का आपस में करने से एक दूसरे से मतलब एक अटैचमेंट भी बहुत ज्यादा हो गया है। ये
आप
मैं
लोग कभी
बताना चाहूंगा।
आप मिले एक दूसरे से अस्पताल में बिफोर द प्रोसीजर? मिले क्या संजीव जी?
अस्पताल में मतलब मुलाकात हुई थी कि कैसे
हाँ।
कैसे मतलब किसको ट्रांसप्लांट होगा, इतना ही। मतलब बड़ा शॉर्ट मीटिंग थी, बहुत ही ज्यादा
अच्छा
डिटेल में बात नहीं हो पाया था।
जी। Before I come to Adesh and Harman, I want to ask you, Arvinder, how do you typically approach this idea? You know, we've all seen those movies, read those books, जिसमें लगता है कि मेरा organ, if my organ is in somebody, then in some ways I feel connected to them. It obviously is quite an overwhelming psychological feeling. अब ये तीन परिवार हैं, they are linked for the rest of their lives. But do doctors encourage families to keep an emotional distance, or do you encourage families to get to know each other? How do you play it?
So honestly, Barkha, we don't get into the psychological story that much because we try to look at things clinically, because at the end of the day, there is a clinical problem and we have to solve it and we have to treat those patients with that disease. Because emotions have no limits, right? You if you get involved this much, then you can get involved the whole way, and
Yeah.
which doesn't work for us. But I think that to answer that question simply, the feeling that your organ is in another person and their life is saved is different with living donation compared to donation after death. Because
Yes.
obviously, that feeling in people who have donated after they've died of brain death is there in their loved ones because they themselves are gone. Whereas this particular feeling of having donated a part of your organ to a living person, in a living person to another person is there in a person who's still living. So I think those two emotions are similar in many ways, but also different because the person who's donated can actually see what they have done to the other person. They saved their lives and made their families happy again. So it's a very very, very emotionally satisfying endeavor if you look at it, even from our point of view.
Absolutely. And as you mentioned, in Sanjeev and Saurabh's case, their wives were the donors. अब बात करते हैं आदेश और हरमन से, where mother and son are going to be telling us their story. आदेश कौर के बेटे हरमन ने अपना liver एक तरह से donate किया, but it is a living donor concept, as Dr. Soin has explained to us. सबसे पहले आदेश जी बताइए क्या क्या हाल है, सब चंगा?
मैं बस बिल्कुल ठीक हूँ. I'm very happy.
You're happy?
Yeah. मुझे बहुत अच्छा लग रहा है. डॉक्टर सोइन की ब्लेसिंग से उन्होंने जो ये स्वैप करा है, 3 लोगों की जान बचाई है. तो ये मेरे ख्याल से वर्ल्ड का पहला केस है जो ऐसे हुआ है. मेरे लिए तो ये एक जादू के समान लग रहा है कि मेरे को ओ पॉजिटिव डोनर मिल गया और मेरे बेटे ने उनको दिया, तो मेरे को बहुत अच्छा लग रहा है.
हरमन आप बताइए, मैंने चांदनी से पूछा कि आपको डर लग रहा था. You're a young man, but still this is a big deal. And you know, while anyone would get up and say, I'll donate my organ for my parent, for my spouse, in this case, आपका organ तो किसी और family में जा रहा है, because of which, of course, your mother's life is, has been saved. How do you feel? It's such an overwhelming moment, Harman ji.
I have no words to thank because we had lost hope because we were not getting in the whole family. There was no group which was matching for my mother. But when we got a call from the hospital that same blood group liver is arranged, we all got very happy, and I'm thankful to God and all the doctors and the team.
And I'm going to ask you the same thing. You know, Dr. Soin was just saying, Herman, that, when you donate your organs after you die, or if you're brain dead, you never get to know whose life you've saved. But here, the three of you, the 3 families, you're going to be linked for the rest of your life. How do you feel about that? Like, would you want to get to know each other better? Or is it too overwhelming to get to know each other too much? What do you think, Herman?
Yes, it's good to know that you are helping someone to live. Actually, my mother's life is saved, and also someone others is also saved. So you feel proud and thankful. That's all.
Saurabh, you want to add something to that? I'm quite fascinated by the dynamics कि आगे जाके क्या संजीव, सौरभ, चांदनी, आदेश और हरमन मिलेंगे, कभी दोबारा मिलेंगे, क्या लगता है?
बिल्कुल मिलेंगे. अब तो ये जीवन भर का साथ हो गया. ये 3 परिवार एक परिवार सोइन सर के बन गए हैं. ये तो जिंदगी भर का रहेगा. जब फॉलो अप पे जाएंगे सर के यहाँ, तो हमेशा 3 परिवार एक साथ जाएंगे. तो अब ये तो लाइफ टाइम रहा कि अब
लाइफ टाइम बॉन्ड हो गया. चांदनी
हाँ जी
क्या बोलेंगे आप?
मैं ये कहूंगी, अब जब हम लोग जाएंगे तो प्लान करके ही जाया करेंगे. अभी भी गए थे तो बात होके ही गई थी. सर ने तो बाद में इनवाइट किया था इसके लिए. हम लोग पहले ही प्लान कर रहे थे कि साथ में जाएंगे.
जी. और संजीव जी, आप क्या बोलेंगे इसके बारे में? क्या एक
मैडम
तरह से कहते हैं ना कि खून का रिश्ता, एक हिंदी में फ्रेज है खून का रिश्ता, ये एक अलग किस्म का खून का रिश्ता है संजीव.
ये मैडम ऑर्गन का रिश्ता बन गया.
बिल्कुल. So I want to go back to the medicine of it, Dr. Soin. You said many things made you nervous. There were ethical, medical challenges. What are the ethical challenges and dilemmas when you do a process like this with a living donor?
About their friendship, now they have become jigri dosts. Jigar ki dosti hai. So, so the ethical dilemmas quite, I can spell it out. They're not easy to resolve these. But basically, the first thing is that there are certain factors that control how well the patients do. There are certain factors that control donor safety when you're doing this operation. And when you're matching up pairs like this, and one family is donating an organ to another, then you have to make sure that the same degree of safety measures are taken for all the donors. And those factors which govern patients' outcomes are similarly matched, right? It would not be fair to match up one recipient whose expected survival is 97% with another one whose expected survival is 70% and expect their donors to exchange livers, and God forbid if something happens to the one who is less likely to survive, then I don't know if you've done the four of them any good. So that's where you get stuck. But we are humans. We tried our best, and luckily it worked. So we match up those factors in these recipients. So when we have a big database of patients who need these kind of transplants, in that their own livers are either inadequate from the size point of view, or they are not blood group matched. And then in that database, we keep matching up patients who would be suitable for each other for a swap transplant. So that's how we go about it.
And medically, while this surgery was on, and as you said, 6 rooms, 6 different teams, 12 hours, 55 doctors and nurses, what was the toughest thing to do? As you said, this 3-way swap has never been done in the world before, Dr. Soin, with livers. It has been done at the level of a kidney transplant. What was the most difficult thing medically?
I think that medically, the thing is that a liver transplant is a very complex operation that typically carries on for between 8 and 12 hours, and a lot of things sometimes crop up which you haven't anticipated, and that needs a degree of judgment and expertise to resolve those things there and then. And obviously, a liver transplant on its own is complex enough. Specific examples, you encounter different anatomy in a particular abdomen which you hadn't anticipated before, which didn't show up on any scan. So how to deal with it, blood loss, how people react differently to different anesthetic medicines. So those things you can't actually do it in any mock drill. So those things are on the spur of the moment. You have to take your decisions based on your experience and expertise, and that part had to be fairly given and kind of you had to do a fair distribution of that kind of expertise to all of the donors and recipients. So that was a big challenge. And then that's how what we decided was we divided up our surgical and anesthesia teams according to their seniority and experience in 6 different lots. And then each of them was running that particular OR, but there was a lot of exchange of information and ideas between the 6 ORs. Of course, I had to keep going across to all the ORs, and so we tried our best to give the best to all of them. And they can be they can be dangerous, they can be risky situations during surgery, and we tried our best to minimize them and get over them with the same degree of a kind of a fairness had to be accorded to all the patients who are undergoing surgery.
Absolutely fabulous. In the end, I'm going to give Adesh ji the last word. Adesh ji, end में अगर आप कुछ कहना चाहे लोगों से, हमारे देश में अभी भी ऑर्गन डोनेशन को लेकर जितनी अवेयरनेस होनी चाहिए वो नहीं है. डॉक्टर साहब इनकरेज करते रहते हैं लोगों को, लेकिन लोग अभी भी परहेज करते हैं, डाउट रखते हैं, स्केप्टिकल रहते हैं, सुपरस्टिशंस भी होती हैं. आदेश जी, पूरी दुनिया को अगर आप कुछ कहना चाहें आफ्टर दिस न्यू लीज ऑफ लाइफ जो आपको मिली है, आप क्या कहना चाहेंगी मैम?
मैं तो यही कहना चाहूंगी कि ये एक मैजिकल टाइम था जो डॉक्टर सोइन के कारण पॉसिबल हो चुका है. तो लोग आके इनसे मिले जिनको भी ये लीवर की प्रॉब्लम है. और मैं ये सोचती हूँ कि डॉक्टर सोइन सबको ठीक कर सकते हैं. बहुत सारी जानें ठीक हो सकती हैं. दुनिया में किसी को भी कोई भी प्रॉब्लम हो लीवर से, तो वो डॉक्टर सोइन से मिले जरूर. और डोनर्स भी घबराए नहीं. ये इन्होंने एक ऐसा स्वैप शुरू करा है जिससे कि आने वाले समय में बहुत सारी जानें बच सकती हैं. और एक नई जिंदगी शुरू कर सकते हैं। उन्होंने हमें नई जिंदगी दी है। इट्स इनक्रेडिबल। मैं अपने वर्ड्स से ज्यादा क्या बताऊं कि मेरे पास वो वर्ड्स ही नहीं है कि जो ये सब हुआ है मेरे लिए। तो ये एक जादू छड़ी जैसे हमारे गुरु हरकिशन साहब जी करते थे, और सारे लोगों का दुख दूर हो जाता था। तो ऐसे ही मैं इनको समझ रही हूँ कि ये हमारे लिए गॉड है, और जो भी ये करेंगे अच्छा ही करेंगे, और दुनिया में लोगों को एक नई जिंदगी मिलेगी।
Gee, Dr. Soin, lot of pressure on you, but for these families, you are sort of a godlike figure. But this is the magic of medicine. This is the magic of calibrated risk, because let's face it, there is a risk in any such process. It is a very difficult first
Sure.
ever such three-way swap. If you want to just close with, I just want to create greater awareness about organ donation. We still do not have the kind of scale of donation that we should have. There is still a sentimentality, in particular to when we lose a loved one, to donate their organs. So let's just close with that thought.
Absolutely. So it's pretty clear and established, and all educated people know that organ transplantation saves lives. Kidney transplant, liver transplant, heart transplants, they're all very, very successful, upwards of 90% successful. And these are all the obviously the last stop, but life-saving for all patients who suffer from respective organ failures of the heart, lung, liver, kidneys. Now, for these transplants to be done, you need donor organs, and one of the sources are people who become brain dead in neuro ICUs after road traffic accidents or strokes, etc. Once they're brain dead, they're dead, and their families should be forthcoming in donating organs, because their loved ones can live through these organ transplants in others. And of course, it's the ultimate, the gift of life is the ultimate generosity that anybody can dream of. And on the living donor side, living donation of a single kidney, among two, or half a liver is also completely safe. And finally, a word about swap transplantation. Swap transplantation can, we believe, increase the living liver donor pool by about 30%, which means 30% more transplants can be done if you use swap transplantation, not just two-way or three-way within the same hospital. We are now actively looking to collaborate with other hospitals in the same city, where we can actually have a chain of 4 or 5 even, so that 2 can be done in another center, 2 in the second center, and 1 in the third center. So that is also possible. And so I think that basically we are looking constantly to increase the donor organ supply, and this is one of the very good methods of doing it.
Yeah, well, absolutely fabulous. I just want to say congratulations to Dr. Soin, of course, but also to Saurabh Chandni, to Adesh Harman, and to Sanjeev ji. It is a new lease of life. आप उसको जादू की झड़ी कहिए, आप उसको Dr. Soin का skill कहिए, आप उसको destiny कहिए, आप उसको कुछ भी कहिए. It's probably a coming together of all of these things. But the strides of medicine and human skill in this also must be underscored. So thank you, all of you. And thank you, Dr. Soin. I think we needed something to feel good about as we close this year. It's been a tough year for a lot of people, and it's good to end on a medical high, as it were. Thank you so much, and all the best to all of you. Thank you.
Thank you, Barkha, for having us.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.